Which of the following best describes human papillomaviruses? A. Human papillomaviruses are small DNA viruses. B. Human papillomaviruses are large DNA viruses. C. Human papillomaviruses are large RNA viruses. D. Human papillomaviruses are small RNA viruses. The answer is A. Human papillomaviruses are small DNA viruses. These viruses replicate in the nuclei of differentiated keratinocytes and are the cause of tumors of the skin and mucosa. The genome of human papillomaviruses is circular and contains approximately 8,000 base pairs. For which of the following viruses is assay by viral enzymes particularly useful? A. Retroviridae. B. Hepatitis B virus. C. Mumps virus. D. Parainfluenza. E. Influenza. The answer is B. Hepatitis B virus. No suitable cell culture system is currently available for the hepatitis B virus. Fortunately, the hepatitis B virus produces a DNA-dependent polymerase that is virus-specific. Influenza A, Influenza B, mumps virus, and parainfluenza virus may be cultured in primary monkey kidney cells. Influenza A, B, and C all may be cultured in eggs. Influenza A and B may be detected by hemadsorption, cytopathic effect, and hemagglutination. Influenza C may be detected by hemagglutination. Retroviridae may be cultured in T lymphocytes with methods of detection of transformation, reverse transcriptase, cytopathic effect, or immunofluorescence. Which statement is true concerning these three sexually transmitted viruses: human papillomavirus, herpes simplex virus, and hepatitis B virus? A. Of these viruses, only human papillomavirus has a genome containing RNA. B. These viruses all have a genome containing RNA. C. Of these viruses, only hepatitis B virus has a genome containing RNA. D. These viruses all have a genome containing double-stranded DNA. E. Of these viruses, only herpes simplex virus has a genome containing RNA. The answer is D. These viruses all have a genome containing double-stranded DNA. Human papillomavirus, herpes simplex virus, and hepatitis B virus are sexually transmitted viruses with double-stranded DNA genomes. While herpes simplex virus has a relatively large genome, the genome of both human papillomavirus and hepatitis B virus are both quite small. Herpes virus can be detected by the Tsank smear of the skin lesion. This test stains for the presence of which one of the following? A. Dead cells. B. Inclusion bodies. C. Multinucleated giant cells. D. Herpes DNA. E. Herpes cell envelope. The answer is C. Multinucleated giant cells. The Tsank smear stains for the presence of multinucleated giant cells that are formed as a result of fusion of cell membranes due to insertion of viral proteins into the membrane. Tsank smear does not detect the presence of inclusion bodies, dead cells, herpes DNA, or cell envelope. Which of the following is an etiological agent of infectious hepatitis and a member of the Picornaviridae family? A. Hepatitis C virus. B. Hepatitis B virus. C. Hepatitis D virus. D. Hepatitis A virus. E. Hepatitis C virus. The answer is D. Hepatitis A virus. Hepatitis C is an enveloped icosahedral RNA virus with gene order characteristic of the family Flaviviridae. The genome of hepatitis C is infectious and consists of a linear single-stranded 9.5 kilobits molecule of RNA. The virus replicates in the cytoplasm. Hepatitis C is transmitted by parenteral and sexual routes. It is the most common cause of post-transfusion hepatitis. Hepatitis C is associated with acute infection, chronic liver disease, and cirrhosis. Hepatitis C viral infection may serve as a predisposing factor in primary hepatocellular carcinoma. Hepatitis A virus and hepatitis C virus are not associated with parenteral transmission. Chronic carrier state. Chronic hepatitis. Cirrhosis. Hepatocellular carcinoma, hepatitis B virus, hepatitis C virus, and hepatitis D virus are associated with parenteral transmission. Chronic carrier state. Chronic hepatitis. Cirrhosis. Hepatocellular carcinoma. A group of teens go on an exploration trip. Against the advice of her friends, a 15-year-old girl goes off by herself and enters a cave. She sees a bat that is unable to fly and, in an attempt to see if it is hurt, approaches it. Unfortunately, she gets bitten by the bat. Because she had been forewarned about entering the cave, she is too embarrassed to tell anybody about the bite. Besides which, the bite marks are small, so she is not concerned. A few weeks after the trip, she becomes very ill. She develops fever, headache, and fatigue. This is followed by hallucinations, seizures, and episodes of agitation. In addition, when she swallows, she has dramatic muscle spasms. She progresses to a coma and then dies. What would be found on autopsy in her brain? A. Howell Jolly bodies. B. Russell bodies. C. Negri bodies. D. Dull bodies. E. Foam cells. The answer is C. Negri bodies. The girl contracted rabies from the bat bite. Since she did not tell anybody about the incident, appropriate prophylactic measures were not taken. The neurologic symptoms she had are all consistent with rabies infections. Rabies is also referred to as hydrophobia because of the muscle spasms that occur when swallowing. The virus which causes rabies is a member of the family of Rhabdiviridae, rhabdovirus. The virus contains a single strand of RNA. Negri bodies are cytoplasmic inclusions seen with rabies. Dull bodies are seen in white blood cells with burns, infections, trauma, and some other conditions. Russell bodies are intracellular accumulations of protein. Foam cells are lipid-laden macrophages. Howell-Jolly bodies are nuclear remnants seen in red blood cells, particularly after splenectomy. It is 9 a.m. on a Monday morning. The nurse tells you that a 20-year-old white male has been worked into the schedule. He has told the nurse that he has had the flu over the weekend. He thought that he would get better. But now his roommate tells him that he looks yellow. In taking the history he complains of malaise, lassitude, anorexia, headache, and low-grade fever for the past week. The only good thing he reports is he doesn't want to smoke. What is your working diagnosis? A. Hepatitis A or B? B. Hepatitis non-A or non-B? C. Hepatitis B? D. Hepatitis A? E. Hepatitis A or B or C? The answer is E. hepatitis A or B or C. The morphologic changes in the liver are often similar for the various categories of viral agents. The liver can appear normal in size and color but is sometimes slightly edematous, enlarged, and bile-stained. On the cellular level, liver cell injury and necrosis and periportal inflammation can be seen. HAV is primarily transmitted through oral ingestion of fecal contaminated material. Transmission by blood transfusion is possible, but is uncommon. HAV is commonly spread among children, or food or water contaminated by fecal matter. Undercooked shellfish may also harbor the virus. HBV is primarily transmitted parenteral and across mucous membranes, especially by sexual intercourse. The average length of the incubation period is 120 days. HBsAg has been found in almost every body fluid from infected persons: blood, semen, saliva, tears, ascites, breast milk, urine, and even in feces. Treatment including bed rest during the acute phase and a diet that is both acceptable and nutritious are the usual general measures. Prevention requires immunization for HAV as well as passive and active immunization for HBV. Although the usual way in which a particle enters a cell is by phagocytosis so that the particle is enclosed in a phagocytic vacuole, there are other methods of entry. If viruses enter cells by phagocytosis, they are destroyed by hydrolytic enzymes. How do most non-enveloped and enveloped viruses enter cells? A. Phagocytosis. B. Neutralization. C. Endocytosis. D. Pinocytosis. E. Opsonization. The answer is C. Endocytosis. Most viruses enter the cell using endocytosis, the invagination of the plasma membrane into smaller virus-sized depressions coated on the cytoplasmic side with a cellular protein known as clathrin. These detach from the plasma membrane and become vesicles free in the cell's cytoplasm. These vesicles fuse with acidic compartments called endosomes. Endosomes then fuse with lysosomes containing degradative enzymes to reduce the ingested molecules to small breakdown products. Macrophages and other phagocytic cells have receptors for the Fc portion of the antibody molecule. These receptors provide a handle for phagocytes to bind coated particles. The coating of pathogens and foreign particles by antibodies is known as opsonization. The simplest and most direct way in which antibodies can protect from pathogens or their toxic products is by binding to them, thereby blocking their access to cells that they may infect or destroy. This is known as neutralization and is important for protection against bacterial toxins and against pathogens such as viruses, which can thus be prevented from entering cells and replicating. Phagocytosis is the ingestion of these coated pathogens or particles by macrophages or other phagocytes, followed by internalization and destruction by intracellular digestion. Pinocytosis is the simple cellular uptake of fluid and solutes. It is a much simpler process than phagocytosis. A virologist specializing in systematics, the study of relatedness of organisms, analyzed data from several studies. Which of the following pairs of viruses are most closely related? A. Enteroviruses and rhinoviruses. B. Rotavirus and echoviruses. C. Enteroviruses and rotavirus. D. Rhinoviruses and orbivirus. E. Poliovirus and orbivirus. The answer is A. Enteroviruses and rhinoviruses. Both the enterovirus group, which includes the poliovirus, Coxsackie viruses, and echoviruses, and the Reoviridae, which includes the reovirus, orbivirus, and rotavirus, have an RNA genome. The genomes of the enterovirus group are linear and single-stranded, whereas those of the Reoviridae are double-stranded and may be either linear or segmented. The Picornaviridae family of viruses contains the enterovirus and the rhinoviruses, which have numerous properties in common with each other. Viruses of this family lack an envelope, and are icosahedral, with a diameter of 20 nanometers. The genome is a single-strand RNA. The enteroviruses are stable to acid, while the rhinoviruses are acid-sensitive. The only double-stranded RNA viruses belongs to the family A. Arenoviridae. B. Picornaviridae. C. Retroviridae. D. Rheoviridae. E. Togaviridae. The answer is D. Rheoviridae. Most of the families of RNA viruses infecting human consists of single strand of RNA, except the family Rheoviridae. The virions in Rheoviridae family consists of double-stranded RNA, made up of 10-12 segments that separates them from other RNA viruses. Rheoviruses are naked with icosahedral symmetry. Rheoviruses replicate in the cytoplasm and are released by cell lysis. Which of the following is a non-enveloped RNA virus from the family Calciviridae that is associated with cholestasis? A. Hepatitis B virus. B. Hepatitis A virus. C. Hepatitis C virus. D. Hepatitis D virus. E. Hepatitis C virus. The answer is C. Hepatitis C virus. Hepatitis C is an enveloped icosahedral RNA virus with gene order characteristic of the family Flaviviridae. The genome of hepatitis C is infectious and consists of a linear single-stranded 9.5 kilobits molecule of RNA. The virus replicates in the cytoplasm. Hepatitis C is transmitted by parenteral and sexual routes. It is the most common cause of post-transfusion hepatitis. Hepatitis C is associated with acute infection, chronic liver disease, and cirrhosis. Hepatitis C viral infection may serve as a predisposing factor in primary hepatocellular carcinoma. A 27-year-old woman presents to her primary care provider with upper respiratory symptoms. An examination of throat swabs and stool specimens indicates the presence of virus particles. Examination of throat swabs and stool specimens is appropriate when, which of the following viruses is suspected? Examination of throat swabs and stool specimens is appropriate when, which of the following viruses is suspected? A. Cytomegalovirus. B. Papavirus. C. Enterovirus. D. Influenza. E. Parainfluenza. The answer is C. Enterovirus. Among the respiratory viruses that can be isolated from throat secretions are influenza, parainfluenza, respiratory syncytial virus, and rhinovirus. These may also be present in nasal washes, nasopharyngeal swabs, lung biopsy, and aspirates of the lower respiratory tract. Additional respiratory viruses, which may be isolated from the stool in addition to the aforementioned locations, are the enterovirus and adenovirus. Certain viruses, which affect the central nervous system, may be isolated from throat swabs, including enterovirus. Cytomegalovirus and herpes simplex viruses are among the viruses, which also can cause CNS illness. These two also cause congenital or perinatal exanthem, in which case isolation may be made from throat swabs. Which one of the following statements best describes prions? A. They are infectious particles composed solely of proteins. B. They are composed of viral nucleic acids but cannot replicate without a helper virus. C. They contain host cell DNA instead of viral DNA within the capsid. D. They consist solely of a single molecule of circular RNA without a protein coat or envelope. E. They are protein particles that generate a strong immune response. The answer is A. They are infectious particles composed solely of proteins. Prions are infectious particles composed solely of proteins. They are not composed of viral nucleic acids and do not need a helper virus to replicate. They do not contain host cell DNA instead of viral DNA within the capsid. They do not consist solely of a single molecule of circular RNA without a protein coat or envelope, and they are not protein particles that generate a strong immune response. A 32-year-old new patient presents for a routine physical exam. The patient confides that he is HIV positive. He has not sought any medical help. During examination of his oral cavity, raised areas that are whitish tan in color with feathery appearance on his tongue are noted. Attempts to scrape the area off for sampling are unsuccessful. What is the most likely diagnosis? A. Hairy leukoplakia. B. Hairy tongue. C. Geographic tongue. D. Candidiasis. E. Atrophic glossitis. The answer is A. Hairy leukoplakia. Hairy leukoplakia may be seen in people infected with HIV and AIDS. It is characterized by raised areas that are whitish tan in color that have a feathery appearance. It is different from candidiasis of the tongue in that hairy leukoplakia cannot be scraped off. A hairy tongue is not actually due to hair growth on the tongue, it consists of elongated papillae that have the appearance of grayish-black hair to the naked eye. This condition may be caused by antibiotic use, or there may not be any reason. Atrophic glossitis, or smooth tongue, presents as having a smooth surface due to papillae loss. The loss may indicate deficiency in riboflavin, niacin, folic acid, vitamin B12, pyridoxine, or iron. A geographic tongue is a benign condition with an unknown cause. It is characterized by a map-like pattern of smooth, red areas that do not have papillae as well as rough areas that still have papillae. Although candidiasis is also common with people with AIDS and the infection also causes the tongue to have a white coating, the coat can be scraped, and a sample can be analyzed for the presence of candida. Fissured tongue is a benign condition characterized by deep grooves, fissures, in the dorsum of the tongue. Although these grooves may look unsettling, the condition is usually painless. Some individuals may complain of an associated burning sensation. The cause is unknown, but it may be partly a genetic trait. Aging and environmental factors may also contribute to the appearance. An unknown virus has been isolated in the laboratory from mouse epithelial cells, which contain reverse transcriptase. The genetic material from this virus is examined and found to contain adenine, guanine, cytosine, and uracil, but no thymine. What can be concluded about it? A. It can only infect bacteria. B. It cannot undergo integration. C. It is a retrovirus. D. It is a prion particle. E. It is a DNA virus. The answer is C. It is a retrovirus. A retrovirus contains RNA as its genetic material, and uses the enzyme reverse transcriptase to convert its single-stranded RNA genome into a DNA/RNA helix, which is then converted to a DNA duplex. This then inserts into the host chromosome, is replicated, and eventually gives rise to single-stranded RNA to be incorporated into the new viral particle. RNA and DNA have three bases in common, adenine, guanine, and cytosine, but RNA contains uracil and DNA contains thymine as the fourth base. Therefore, finding uracil in the viral genome indicates that it is an RNA-containing virus. Since it contains reverse transcriptase, we can deduce that it is retrovirus. Which of the following methods is the most precise, universally useful technique for enumerating infective virus particles? A. Electron microscopy hemagglutination. B. Pock assay. C. Plaque or focal assay. D. Quantal assay. E. None of these. The answer is C. Plaque or focal assay. The keys to this question are the terms universally useful and infective. Some of the described methods lead to the counting of both viable and non-viable particles, as described below. The plaque assay is the most precise measure of infectivity. The basis of this technique is the formation of clear zones, plaques or foci, in a monolayer of host cells. Serial dilutions of the virus are added to a monolayer of cells known to be infected by the cells. For example, MDCK cells are used for influenza. Most commonly after the virus has been allowed to adsorb bone to the cells, an agar overlay is added to prevent dispersion of the virus. This ensures that each plaque represents only a single initial virus particle. For viruses which only infect contiguous cells without releasing virions into the surrounding medium, the agar may be replaced by a liquid. A 21-year-old woman developed low-grade fever, sore throat, malaise, and fatigue that lasted several days. Physical examination revealed swollen lymph nodes and discomfort in the left upper quadrant of the abdomen. Examination of peripheral blood smear revealed 50% of atypical lymphocytes of the total white cells. Result for heterophile antibody test was positive. What is the most probable cause of infection? A. Respiratory syncytial virus. B. Cytomegalovirus. C. Influenza virus. D. Epstein-Barr virus. E. Varicella-Zoster virus. The answer is D. Epstein-Barr virus. Epstein-Barr virus and cytomegalovirus elicit a large T-cell response, resulting in a mononucleosis-like syndrome. EBV infection is subclinical and milder in children than adolescents or adults. EBV initiates infection in the epithelial cells of the oropharynx and then spreads to the B lymphocytes in lymphatic tissue and blood. Classical lymphocytosis is associated with the activation and proliferation of suppressor T cells, and it leads to infectious mononucleosis. The atypical lymphocyte, also known as Downey cells, increases in peripheral blood during the second week of infection. Major T-cell response causes swollen lymph glands, spleen, and liver. Fever, malaise, fatigue, pharyngitis, lymphadenopathy, and hepatosplenomegaly are the classical symptoms associated with infectious mononucleosis. An epidemiologist studies virology data including the names of virus families and the nature of the genome. Which of the following families contain RNA viruses? A. Herpes viridae. B. Parvoviridae. C. Poxviridae. D. Reoviridae. E. Adenoviridae. The answer is D. Reoviridae. Except for the Reoviridae, which contains the orbiviruses, rotaviruses, and reoviruses, all of the families mentioned are DNA viruses. The Parvoviridae and Adenoviridae families contain the parvovirus and adenovirus, respectively. The viruses in both of these families have a naked virion, that is, without an envelope, but viruses in the former family have a complex nucleocapsid structure, while those in the latter family have an icosahedral nucleocapsid symmetry. The herpes simplex virus, cytomegalovirus, varicella-zoster virus, and the Epstein-Barr virus all belong to the herpes viridae family. The family of poxviridae contains complex viruses with a naked virion, such as the vaccinia, smallpox, and variola viruses. An epidemiologist at a school of public health of a major medical school examined data from several studies performed by microbiologists. The data set included information about the nature of the etiological agent, virus, rickettsia, chlamydia, viroid, the nature of the genome, DNA or RNA, and whether the agent is obligate intracellular or parasitic. The epidemiologist wishes to determine which features pertain to each disease agent. Which of the following properties is unique to viruses alone? Which of the following properties is unique to viruses alone? A. Obligate intracellular. B. Extracellular. C. Presence of DNA genome. D. Parasitic. E. Presence of an RNA genome. The answer is E. Presence of an RNA genome. Rickettsia, chlamydia, prions, and viroids can be distinguished from viruses, but not by just one of the mentioned criteria. While all of these groups are obligate intracellular organisms, only the viruses are parasites with an absolute intracellular requirement, which also depend on the machinery of the host cell for replication. Prions are small infectious protein particles. Viroids are subviral infectious nucleic acids, which lack even the protein capsid found in viruses. Viruses may contain a genome of DNA or RNA, so the presence of an RNA genome is indicative of a virus, but the presence of a DNA genome is not. Which of the following is an enveloped RNA virus from the family Flaviviridae and is the major cause of post-transfusion hepatitis? A. Hepatitis B virus. B. Hepatitis D virus. C. Hepatitis C virus. D. Hepatitis C virus. E. Hepatitis A virus. The answer is C. Hepatitis C virus. Hepatitis C is an enveloped icosahedral RNA virus with gene order characteristic of the family Flaviviridae. The genome of hepatitis C is infectious and consists of a linear single-stranded 9.5 kilobits molecule of RNA. The virus replicates in the cytoplasm. Hepatitis C is transmitted by parenteral and sexual routes. It is the most common cause of post-transfusion hepatitis. Hepatitis C is associated with acute infection, chronic liver disease, and cirrhosis. Hepatitis C viral infection may serve as a predisposing factor in primary hepatocellular carcinoma. Which of the following clinical conditions is associated with Coxsackie virus type A? A. Herpangina. B. Hepatocellular carcinoma. C. Smallpox. D. Gingivostomatitis. E. Cervical cancer. The answer is A. Herpangina. Coxsackie virus type A and Coxsackie virus type B are members of the P. Cornaviridae family. Coxsackie virus type A is associated with herpangina, which is commonly seen in children. Herpangina is a severe febrile pharyngitis characterized by vesicles or nodules primarily on the soft palate. The majority of cervical cancers, approximately 90%, contain human papillomavirus DNA, usually of type 16 or 18. A researcher specializing in systematics of viruses tabulates data from several epidemiological studies. The data she receives include the names of the individual viruses, the families to which they belong, the type of genome, presence of an envelope, the morphology of the virion, and which viruses are related to each other. Which of the following families contains the influenza virus? A. P. Cornaviridae. B. Coronaviridae. C. Orthomyxoviridae. D. Rhabdoviridae. E. Parmyxoviridae. The answer is C. Orthomyxoviridae. All of the families mentioned are RNA viruses. The P. Cornaviridae family contains viruses that lack an envelope and are icosahedral, rather than helical, in morphology. The P. Cornaviridae family contains enterovirus, cardiovirus, and rhinovirus. The Orthomyxoviridae family contains the influenza virus, while the Paramyxoviridae family contains the para-influenza virus. The Rhabdoviridae and Coronaviridae families contain the rabies virus and coronaviruses, respectively. A 1-year-old boy presents with barking cough and inspiratory stridor. What virus is the probable causative agent of the infant's illness? A. Parainfluenza virus. B. Influenza A. C. Rhinovirus. D. Respiratory syncytial virus, RSV. E. Adenovirus. The answer is A. Parainfluenza virus. The child has the characteristic symptoms of laryngotracheobronchitis, commonly known as croup. All of the listed viruses can cause respiratory tract infections in infants and young children. each producing different clinical manifestations. Parainfluenza virus is the most common agent of croup. Types 1 and 2 are particularly associated with this disease. Croup is characterized by respiratory obstruction due to swelling of the larynx and related structures. Infection may spread deeper to the lower trachea and bronchi, culminating in pneumonia and bronchitis. The infection is seen mostly in 6 to 18-month-old children. How is the recombination of RNA segments from two different influenza virus strains described? A. Peptidoglycan. B. Antigenic drift. C. Antigenic shift. D. Teichoic acids. E. Prions. The answer is C. Antigenic shift. Antigenic shift and antigenic drift can be found in the influenza virus. Antigenic shift is a process by which two or more different types of influenza A combine to form a virus radically different from the ancestor strains. Antigenic shift occurs in two ways. 1. Antigenic shift can occur through genetic recombination, or reassortment, when two or more different influenza A viruses infect the same host cell and combine their genetic material. 2. An influenza A virus can jump from one type of organism, usually a bird, to another type of organism, such as a human, without undergoing major genetic change. A point mutation that leads to an amino acid change and altered antigenic sites so that the virus is no longer recognized by the host immune system is called antigenic drift. Peptidoglycan and teichoic acids are components of the bacterial cell wall and prions are infectious protein particles. A patient has all the gastrointestinal symptoms of infection with hepatitis virus, HAV, yet all the tests for HAV-IgG and HAV-IgM are negative. Laboratory diagnosis reveals A. Positive, RNA virus. Which of the following is the most probable diagnosis? A. Rhinovirus. B. Hepatitis C. C. Hepatitis C. D. Yellow fever. E. Rotavirus. The answer is C. Hepatitis C. Hepatitis C virus is a naked, plus, strand, ssRNA virus. It has clinical and biochemical features that are very similar to hepatitis A, except that it seems to be more severe in pregnant women. Therefore, hepatitis C is the virus that is most likely the cause of disease in this case, if serology indicated the absence of hepatitis A. The other choices are incorrect. Hepatitis C is enveloped and does not cause gastrointestinal symptoms. Rhinovirus causes common cold. Rotavirus does not present with jaundice as do hepatitis-causing viruses. Last, yellow fever can be associated with hepatitis, but it is a lot more severe in presentation than hepatitis A and is transmitted by mosquitoes, not fecal-orally.